Here we go again. The AMA and others are talking about tougher lockdowns in Victoria. More warnings about unnecessary travel in Queensland and the threat of more widespread restrictions. Tougher restrictions imposed today in South Australia and New South Wales. A delay in the easing of restrictions in Western Australia. The rhetoric and actions of our politicians are now going all in the one direction. They've done an about-face on their claims back in March that the national aim, was to slow the spread of the coronavirus while we built up medical capacity to deal with it.
The goal here is very straightforward, and that's why we've been going about it in a very careful way. And there's been an abundance of caution in our approach. It is simply to slow the rate of transmission of the coronavirus within Australia.
Prime Minister Scott Morrison there 4 months ago. Now, we've long since built up the healthcare capacity. Less than 1% of the critical care beds we've built up are being used. And state governments in particular, though, are still cracking down on society, killing businesses and crushing livelihoods. After National Cabinet today, Scott Morrison insisted the strategy hasn't changed, aiming for suppressing the virus rather than eliminating it.
The goal of that is obviously, and has always been, no community transmission. There will always be cases that come, because Australia has not completely shut itself off from the world. To do so would be reckless. But that no community transmission, where the vast majority of states and territories have been at now effectively for some time, and that's certainly where we want to get back to in Victoria and New South Wales.
But having no community transmission, that is no transmission of the virus within our communities in Australia, sounds very much the same as elimination, doesn't it? It means we only have the cases that come into this country. Is the elimination of community transmission achievable in Australia? Or have we become a victim of our own success? We crushed the virus so well first time around, we think we can quell it for good. What we have done already has blown our budget for a generation and burdened our children and grandchildren with a mountain of debt, not to mention those unemployed or with their businesses crushed now. And if the virus disappeared tomorrow or a vaccine was available worldwide next week, our current leaders would go down in history as geniuses. We will have dodged a bullet. But we've got to face reality. The virus, which infects everyone but is a deadly threat to the elderly, is highly contagious and will be with us for a long while to come. We have to learn to live with it. That'll mean protecting the elderly and the vulnerable within intense quarantine and distancing around aged care homes, and also protecting the frail. We all wish it could be eradicated. We all wish no one would get sick. But the reality is we have to deal with it. Victoria is in its second lockdown. Will it have another lockdown later this year or another one next year? Can we keep shutting cities, locking down states, blocking borders? The key word here is sustainable, not the way you hear all the lefties and the United Nations use this word in the years up till now. We need to use this word now when we talk about coronavirus responses. What are we doing that is sustainable? What are we doing now that we can plausibly still be doing in a year or 2 years' time? We certainly can't be spending this much money. We certainly can't keep businesses and workplaces closed. This is just stuffing out people's futures. We can't keep borders closed for that long, separating families, splitting communities and bringing businesses to a standstill. None of this is sustainable. There is a great pretense that if we do this or that for a few weeks or a couple of months, then we can get back to normal. The virus is the new normal. You've heard so many experts on this program and others, and they've told us that we have to work out how to live with the virus. Masks in public? Yes, that's the future. Strict hygiene and lots of social distancing? Of course. Closing hotspots down for a quick clean and check and testing and tracing outbreaks? We'll certainly have to keep doing that, and Daniel Andrews now has got the Army helping out with that in Victoria. And most importantly, we've got to find those ways to protect aged care homes. Most of Victoria's second wave of deaths have been in aged care settings. We also need to help the elderly isolate from the possibility of infection at home too. I wish it were different, but it's clear from all the experts that a widely available and effective vaccine is so far away that we need to find sustainable ways to deal with this pandemic. We have to put ourselves as a nation so far in the position to fight this. I mean, I think we've done this better than just about any nation on the planet so far. We've put ourselves in a very, very enviable place with low infection rates, low death rates, ample medical capacity, plenty of wage and welfare support. But pretty soon we have to work out how to transition from that to living with the disease. The country has weathered one of the most traumatic, devastating, damaging and costly lockdowns. Is it really sustainable now to go back down that path? We've been through all that once. Victorians are doing it again. Can the whole country go down that path a second time? Can we afford it? Will we survive it? This is the question we need to ask of every government action and response, especially from the states who seem to be in a competition on this issue. Are their actions sustainable? I just don't think what we're doing now is anywhere near sustainable.